Good morning, good afternoon, and good evening to everyone joining us across different time zones. Thank you for being here on such short notice. My name is Maysa Hawash, and on behalf of Doctors Against Genocide, I want to welcome you all to this urgent press briefing. We are gathered today because Gaza's hospitals are taking their last breath. In the past week alone, 3 major hospitals have been forced out of service, and Al-Shifa, Gaza's largest, is barely standing. These systemic assaults on healthcare facilities are not isolated incidents. They follow a documented pattern of intimidation, siege, and destruction, leading to mass displacement and death, all instruments of this ongoing genocide. Attacking hospitals is a war crime. Every hour of silence costs lives. We also want to highlight a dangerous new development. Just yesterday, Prime Minister Benjamin Netanyahu ordered the full closure of Allenby Bridge, the only crossing point linking the West Bank to Jordan and to the outside world. This decision, made in retaliation for the recognition of the state of Palestine, has effectively cut off the entire West Bank from the outside world. Right now, no one can enter or leave. Among those stranded in Amman are medical teams who are en route to Gaza to provide urgently needed support. This blockade is another dimension of the genocidal campaign, a deliberate act to dismantle Palestinian healthcare infrastructure, not only in Gaza, but across all of Palestine. Today, we will hear directly from Palestinian doctors on the ground in Gaza. Hopefully, we can get some of our Gaza doctors to join us. As you all know, the connectivity is always a challenge, and there's direct and imminent threat to their lives. As well, we will hear from Doctors Against Genocide leaders, international medical advocates. Their testimony will shed light on the realities of patients and healthcare workers, what they're facing right now, as intensive care units collapse, supplies vanish, and civilians are left without safe access to the treatment. The press briefing is being held virtually on Zoom. The Zoom will be recorded. It's also live streamed on YouTube and our social media handles. We will begin with brief statements by doctors with us today, and I witness testimonies from Gaza if we can get the doctors to join us. Then we will follow for Q&A from media contacts. Your media contacts for follow-up are Dr. Nadar Jabbour from the US, myself, Maysa Hawash in Canada, and Dr. Azra Chang in the UK. We urge all journalists to document and report these urgent testimonies. The collapse or raid of Al-Shifa Hospital could happen at any moment. We don't have a lot of time. This is not just a health crisis. It is a matter of life and death, and the world must bear witness. Now I will hand it over to Dr. Azra Chang, who is a healthcare systems analyst and a medical doctor who's joining us from the UK. Thank you.
Thank you for having me, Maysa. So I think I'll probably start off by giving an update on North Gaza, because I think that's probably the area that's under most heavy violence and bombardment by the Israeli military. So as of the update from this morning from local senior healthcare officials and medics on the ground, we have 6 partially functioning hospitals. I don't have any information about the primary healthcare centres. I am aware that there are still a few that were partially functioning, but that was information from last week. The patterns of attack are looking like that they are going in geographical location, and this is something that has been reported by the local healthcare community in how they're witnessing the attacks. They're saying that they are going in location codes as per the quadrants that the Israeli military divide different geographical locations of Gaza. And what it appears to be that it's going from west, northwest, eventually south. And based on that pattern and what they're seeing, the hospitals that the local healthcare workers predict to be falling next are Al-Ahli Baptist Hospital, Al-Hilu Hospital, Al-Sahaba, Al-Quds Hospital, which is Palestinian Red Crescent affiliated, the Kuwaiti Field Hospital, also Palestinian Red Crescent affiliated, and then the last one in that order would be Al-Shifa Hospital, which, if this observed pattern is correct and upheld. Now, this pattern is really based on the system that is well documented with the UN OHCHR report that came out in December of 2024, based on a 4 to 6 step process of how a hospital is decommissioned. Um, and often it starts with a public relations campaign, which is what we're now seeing with regards to Shifa Hospital. So if I start with Al-Ahli Baptist Hospital, we know that on that list, which starts off with a public relations campaign to give some form of reason as to why the hospital should be attacked. Often it's stating that it's a Hamas base or if there are combatants inside the hospital. And to date, there has been no evidence to prove this at any point with any of the available data. Um, then, following this, there'll be attacks within the immediate vicinity of the hospital, whether this is a campaign to drive out patients and staff. In addition to this, the next step is often a siege on the hospital, so stopping any form of aid reaching the hospital from the WHO or any other organizations such as food, water, medical supplies. Now, this, in the context of what's happening in Gaza right now, the entirety of Gaza is being under a complete blockade. And then the final steps really are direct attacks on the hospital, and finally invading the hospital. So the Israeli military will then enter a hospital, often divide men and women and children separately, question and then arbitrarily detain often the men. And the final piece is often destruction of the hospital, which has been witnessed by many healthcare workers, where the equipment and the hospital itself is destroyed, as we've seen with Shifa Hospital that has been set on fire in November of 2023, and Kamal Adwan on December 2024, where it was set on fire. I will talk about the implications for the local population and the wider implications about what dismantling the healthcare service means to a local population. Maybe I can talk about that a bit later. But I think for now, what we're seeing is, in terms of that list, Al-Ahli, which is set to be the next one to fall, effectively the staff have been. The last update is majority of staff and patients have fled the hospital because of the very, very close range fire almost within the perimeter of the hospital. And there are a few hospital members, staff members left just guarding the building and the patients that could not move. With regards to Al-Hilu Hospital, which is next on the list, some staff members have been called directly by assumedly Israeli authorities. And this is something that quite commonly happens where they will contact healthcare workers directly, ordering them to evacuate the hospital. Now, unless there's an official evacuation order, which has not been issued from COGAT, this is not really an official means of communication. The order needs to be COGAT or the CLA, which is a form of is part of the Israeli military, need to communicate with OCHA, who will communicate with the WHO and the hospitals and organized and ordered evacuation. However, we've seen time and time again, this is not the order that the Israeli military follow. And as a result, in Al-Hilu Hospital, certainly some staff and patients are packing their things and leaving. I don't have any information about Al-Sahaba. Al-Quds Hospital, which is the Palestinian Red Crescent affiliated, is effectively encircled by Israeli military tanks, and there has been gunfire, which appears to be unilateral according to the staff and civilians inside, directed within very, very close range of the hospital. There has been no formal evacuation order. I have been told by a very reliable source that a evacuation request has been made by the hospital, which was rejected by COGAT. So please feel free to verify that with COGAT and the International Committee of the Red Cross. As far as I know, there are 2 neonates in neonatal intensive care, both incubator dependent. The hospital is due to run out of oxygen and fuel within about 72 hours possibly less, and therefore that will risk the lives of these particular infants. There are more patients in the hospital, but I don't have any detail on them. And there is very limited supply of food and water for the staff and the patients, including baby formula. With regards to the neonatal infants, one of them is not very stable, and therefore moving this child would mean that they would potentially risk their lives, as any bombardment. This is what the nursing staff who have been looking after this infant, any very loud bombardment has resulted in this child's heart rate dipping to a level which would be classed as a cardiac arrest for a child that age. And so loud noises are affecting this child. So transporting this child could potentially be fatal to her. So I will keep an updated stream with them. And finally, Al-Shifa Hospital. I have had very limited updates. As far as we know, it's partially encircled by the Israeli military. They're approximately a kilometer away. Kogat issued a statement on Twitter this morning stating that there was gunfire from within the premises of the Shifa Hospital. I have spoken to staff in the hospital, and unofficially, this is not an official statement from Shifa, but this has been denied and rejected, that there is any form of combatants or any military target within the hospital. And this is really the roundup of the healthcare system in North Gaza. The final thing to say is that, as I've been told by senior healthcare officials, there are no life-saving healthcare facilities in North Gaza, only life-sustaining. And what I mean by that, there is no capability or capacity to perform anything life-saving, such as major surgery, because there is no equipment or surgeons or facility to do this. Only life-sustaining, such as intensive care and treating minor wounds. Everything at this moment in time is really to sustain life rather than save life.
Thank you, Dr. Chang. I appreciate the update. We have Dr. Ahmed Al-Farra and Iyad Amawi, who just joined us from Gaza. If I may ask Dr. Ahmed Al-Farra to give us a brief overview of the situation currently in Khan Yunis, and we hope to be joined by other doctors from Al-Shifa Hospital, but as we know, it's a very difficult connection in Gaza right now. Please go ahead, Dr. Ahmed.
Assalamu alaikum.
Alaikum salam.
As I been told by Dr. Nidal that we have short of time and I have to talk in a brief. I'll talk just in 2 minutes. Okay, I'll start by OCHA statistics, which are talking about 28,000 child below 5 years are diagnosed in Gaza as severe acute malnutrition. And this is this number exceeds the number of the severe acute malnutrition who were already diagnosed since the beginning of the year. I'll talk about our rotation today in the morning in Nasser Medical Complex. I was with the media team of Ministry of Health. They asked me that they want to make some a short film about the situation in Nasser Medical Complex, especially the overcrowdedness in the neonatal ICU. When we get in the neonatal ICU, we have the open system. The open system should be always free from patient or free of neonates. They keep, it's just for examining, just for take blood sampling, just for making cannula for the neonate. The open system has 6 cases. You can imagine 6 cases are being included in the open system. 3 of them are on oxygen, 1 of them is on mechanical ventilation, and 2 of them are under observation. This is the first time since the Nasser Medical Complex neonatal ICU was started. This is the first time this thing to happen. We get out from the neonatal ICU and we go to baby-friendly room. We were shocked also. We saw 3 mothers with 3 babies on 1 bed. they told us that none of us could be slept 1 minute at night because we have to be close to our unit. All of them, they have bronchiolitis, inflammation of the bronchioles, which we have outbreak nowadays in Gaza. All of them are severely distressed. All of them need oxygen. All of them need nebulizers. What is more shocking or more striking for us that the source of oxygen in the room was divided 20 minutes for each unit. That means this unit is put in oxygen, and after 20 minutes, he will subside, and another unit come instead of him. I looked down. I saw 3 units. They are nearly 21 days, 14 days, 7 days. All of them were premature. They were put on the ground, on the mattress, one of them on the mattress on the floor, and one of them on the blanket on the floor. That was, in a brief, our situation in Gaza. I will not talk about the shortage of medical supply. I will not talk that I was in bad need today for normal saline. I didn't found normal saline. I didn't found drinker lactate for my patient who are complaining from gastroenteritis and severe dehydration. I will not complain about the shortage of alcohol and chlorine. I will not talk about the shortage of gauze. I will not talk about shortage of everything in the hospital. This is the situation in Gaza. Thank you.
Thank you so much, Dr. Al-Farra. We appreciate your testimony. Iyad, do you want to share with us a brief overview of the situation currently in Gaza?
Yeah, Assalamu alaikum. I hope everyone is well. My greetings to all of my colleagues and especially Dr. Azra. Maybe I see her for the first time in our webinar, and we know her very well, mashallah alayha, and Allah grant her everything she deserves, her effort for all of the time. I will talk about destroying the symbols of Gaza life. Also targeting hospitals in general as a tool of slow genocide and forced displacement. It's very important to recognize about the reality about the Israeli occupation plan. From the very first moment in this genocide, Israel began its campaign of incitement against Gaza's hospitals, accusing them of being command and control centers. For the militants or something like that. The outlines of systematic plan began to emerge. This narrative is not new. It dates back to 2014, when a lot of Israeli retired generals in the army stated in multiple interviews that to control Gaza city or to expel people, you must control the hospitals. Since then, Israel has built an entire strategic myth around the idea that hospitals are legitimate military targets, and that controlling them would mean controlling of Gaza city or Gaza Strip at all. This myth later became a ready-made justification for the destruction of the largest medical facilities in the Strip, and by extension, other hospitals also. So it's repeated actions that's still happening now in Gaza City. This escalation didn't target military objectives as claimed by struck at the last remaining pillars of the civilian life. Hospitals in Gaza are not mere buildings. They are centers of hope, the last refugee for the wounded and the sick, as Dr. Ahmed mentioned, a source of energy, care, and medical nutrition for children and the elderly. They symbolize the survival of life itself in the face of siege and war and genocide. Destroying these beacons of hope is meant first and foremost to break will of society also, to push people into despair and rob them of their ability to endure and to implement the Netanyahu plan to expel people from Gaza, as he mentioned a lot of times before. When the health system collapses, survival in Gaza becomes almost impossible. A parent who cannot talk, treat their children, a patient who can't find life-saving medication, or a wounded person with no hospital's bed, all become more likely to abandon their homes. This directly serves the state and stated goals of the Israeli occupation government in tying Gaza of its population. Until this moment, they still opening the coastal road and force people to be expelled, threat them, and explode robotics around them to force them to be expelled completely from Gaza town. Even more alarming is that the remaining hospitals and medical centers can no longer meet even the minimum healthcare needs. Their capacity covers only a tiny fraction of the overwhelming number of wounded and sick amid the catastrophic shortage of medicines and medical supplies. We must repeated power outages and fuel depletion. This is reality has led to the deaths of thousands and patients, not only because of the severity of their injuries, but because basic medical needs it's not available, it's simply unavailable. This constitutes a grave violation of international humanitarian law. But I will talk about something very important. There is no free space now in the middle governance also, and what's remaining in Khan Yunis and little land in the coastal area. They shrink the free space just up to a 12 percentage of all of the spaces available in Gaza State. So it's not. They need to normalize us to accept this, and they push people. I know thousands of people. They slept in the street for more than 3 days, up to 4 days. They searching a lot of times about free land. There is no free space. There is no tents also or shelters. So the danger is here. Concept to promote in some political and media circuits voluntary immigration. In reality, this is a linguistic deception also, Michael. It meant to whitewash forced displacement. People are not leaving their homes by choice, but under inhuman conditions. Hunger, disease, lack of security, and a total collapse of services deliberately created to force them out without overtly expelling them. Under international law, this constitutes forced displacement. Not other words can describe this. What's happening in Gaza today up to this moment is a form of slow genocide. They follow this very well calculated policy where indirect tools, siege, starvation, and the collapse of healthcare and increasing the suffering and grant black and shadow economy to work very well here are used to gradually destroy the society without the spectacle of rapid overt mass killing, justifying hospitals attacks through the fabrication of military objectives does not change the fact these acts flagrantly violate Geneva and all of the international humanitarian law. So the systematic, destruction of Gaza health system with the siege and deprivation of basic rights is a strategic tool designed to eliminate the life and the foundations of life and push the population to leave. I talked the last time about they grant people 3 up to 5 minutes to evacuate their apartments. Today, I witnessed in Gaza town, they grant them 2 minutes just, and all of the people ran the street. There is no directions. There is no any guarantee shelters to take them safe. This is not conventional military battle. It's an organized effort to reshape Gaza demographically, physically, reality by force, turning the state into an empty land, as they mentioned, and empty territory stripped of its people. So their goal is very clear for us, and they would complete if there is no any real pressure over them to stop the genocide. What's still happening until this moment in the remaining functioning hospital in Gaza town they need to destroy the Gaza last life signs to complete their military, or between two quote, military targets, cleansing land of Gaza City and shrink people into maybe a big prison in the south. And if you touch something very important, my colleague, they extend the warehouses distribution GHF by 2 centers in the south. So we have now 6 centers of distribution. Now it's not functioning like before, but in my observation, they will use it when they complete destroying Gaza City, as they mentioned in their plan. So they are clarifying GHF distribution center. They will use it to serve their military plan to complete destroying Gaza and expel live or deep. Thank you so much for your efforts. I'm ready for any questions, my colleague. And again, we will not give up, and we will continue to stand facing this genocide, inshallah. Thank you so much.
Thank you so much for your powerful testimony, as always, Iyad. We appreciate you showing up and sharing your insights with us. Now I'm going to turn it to Dr. Yiping Ji, who will give us brief comments on the situation in Gaza and the advocacy work that we are doing to support our healthcare worker colleagues in Gaza. Go ahead, Dr. Ji.
Thank you. And I'm glad we could hear from our colleagues on the ground in Gaza right now. And we have even our international volunteer colleagues based in Canada who are also on the ground working alongside Palestinian healthcare workers who continue to endure this, genocidal violence on the healthcare system. I thought I would share some examples from my experience of working in Gaza as a medical volunteer from Canada. Before I even started to work at the multiple primary care clinics that I did in Central Rafah last year, I was supposed to work at Nasser Medical Complex in the emergency department. But at that time, in February last year, Nasser Medical Complex was surrounded by Israeli tanks. And it was during my time in Central Rafah working in primary care clinics that the Nasser Medical Complex was besieged and raided by the Israeli military. They entered the medical complex and arrested, detained healthcare workers and patients, and also executed them. And we know of mass graves around Nasser Medical Complex where these patients and healthcare workers were buried. And the Israeli military also destroyed medical equipment like ultrasound machines and cut the probes of these ultrasound probes off of the machines itself. Because where there is a clinic or a hospital, there is life. This is the last line of defense for Palestinian life in the Gaza Strip as they continue to experience genocide. And the repeated attacks on healthcare is exactly part of Israel's genocidal plan to ethnically cleanse, forcibly displace, and colonize Palestine and colonize Gaza. I also had the privilege of visiting European Gaza Hospital to deliver medications and supplies. And I remember visiting the intensive care unit and seeing children who sustained gunshot injuries to the chest and to the head, including to the skull. And we have so many countless testimonies of this, of the targeted attacks on children, but also the targeted attacks on healthcare workers, where our Palestinian healthcare worker colleagues, for simply wearing scrubs, for simply wearing a white coat, they are targeted more so by the Israeli military, because to target the healthcare system that is Palestinian-led is part of that colonial genocidal plan to take over the Gaza Strip. When I visited European Gaza Hospital, I could see thousands of internally displaced Palestinian families living amongst the clinics and the hospital itself, inside the hospital, in the hallways, wherever people could find room, they created a makeshift shelter for themselves. And then later I saw the Israeli military forcibly evacuated European Gaza Hospital, and to see the empty hallways of the European Gaza Hospital from afar, from my phone, is just absolutely devastating, because people are so fearful for their lives that they are leaving these hospitals, like where Rantisi Children's Hospital was bombed multiple times. So many patients that required medically necessary treatment, life-sustaining treatment in these hospitals, decided to leave and face not receiving that treatment for fears of the Israeli military coming into these hospitals, detaining people and killing them, as they have done repeatedly, again and again and again. And they continue to do this, as was previously described with the hospitals in North Gaza right now. I'll briefly touch on, in Canada, as Canadian healthcare workers, we have organized a large petition and letter for the Canadian government to align itself under its own obligations under international law and the Genocide Convention, which is to prevent and punish genocide. As an international community, we have utterly failed to prevent genocide in Gaza at the hands of Israel. But there is this moment right now to do everything we can within our power, including the states that are so heavily complicit, to end their complicity, but align themselves under international law and their obligations under international law and the Genocide Convention, which is to stop arming Israel, apply sanctions, stop free trade, and to punish and prosecute the companies and the individuals that are committing this genocide. We have Canadians that went from Canada to Israel to put on an Israeli military uniform to go into Gaza and kill babies and children and civilians. This is our responsibility when we have privilege in the West. As a Canadian passport holder, this is our responsibility, for me and so many others, to hold our governments accountable, to hold Israel accountable for its genocidal crimes in Gaza.
Thank you so much for your powerful words, Dr. G. Dr. Muhammad says you've also been to Gaza and you've shared your testimony, which is very powerful, several times, and maybe you can help us shed some light on the current crisis and situation that's unfolding in Gaza.
Right. First of all, I just want to say hello, salam to all the amazing doctors from Gaza. There's nothing really else I can add to their lived experience. But during my time in Gaza, I was there several months ago, and I entered 6 different hospitals. Every one of the hospitals had been shelled, had been burned. But the people of Gaza, ever industrious, have gone back and actually reopened the hospitals so that they can continue providing care to their community. Since that time, Israel has continued the assault on the hospitals, especially the ones in the north, which have been chronically understaffed, short of supplies, despite being such vital lifelines in the community. I myself am a pediatrician, and so I was working primarily in the children's hospital. At the time, there was one children's hospital, and now Al-Rantisi Children's Hospital reopened, but was actually has actually recently closed and destroyed because of the psychological threats being made to staff, the bombing of the actual hospital itself. It had the only dialysis unit for children in the north. Patients who are on dialysis need frequent treatment, and they are very difficult to move. They become unstable easily. And so now that vital lifeline has been taken away from them, there is nowhere else for them to get it. Remaining in the north. If you look at a map of Gaza City and you look at which hospitals are now reporting closure and where doctors are receiving calls and threats, you see that it is kind of encroaching more so from east to west, north to south, as they push to clear out Gaza City. They need to clear out the hospitals as well to complete the ethnic cleansing of this area, because hospitals are such a vital lifeline within that space. And so Rantisi Children's Hospital, the ophthalmology hospital next to it, which are further east, have now been closed. The Shifa Hospital, which is closer to the center of Gaza City, I'm speaking with doctors on the ground there. They report that they've been getting threats, that they've been that there have been bombs and shelling in their vicinity, and they are being told that they need to evacuate that hospital as well. And progressively, we will continue to see this happen. The other major red flag for myself, and just speaking with healthcare workers on Gaza and observing the pattern of which hospitals have been targeted by the Israeli military, is the prevention of any additional foreigners from actually coming into Gaza to provide medical aid, provide medical services with the closure of the Allenby crossing. The only way we were able to get into Gaza was to go through Allenby crossing because we were not even allowed to land in Ben Gurion Airport as international medical workers. We saw it with the Indonesian hospital before it was sieged. They actually removed all the Indonesian medical workers from coming there. We've seen it with other hospitals like Kamal Adwan, where they prevented international medical teams from going there 2 weeks prior to the hospital being invaded. I walked through Kamal Adwan. I saw that the hospital had been lit on fire, that the hospital had been shelled, and I was given free rein to walk around there. Nowhere did I see anything that would justify the barbarity that was unleashed on this hospital providing life-saving aid. Yeah, there's not much more to say other than that this is the moment that we need to act to save lives in northern Gaza. Gaza still has a population of 2 million, half of whom being children, and a third of whom are still around in the north. We're talking, 300,000-400,000 children minimum are still in that space, and there's a few hospitals that are barely functioning that remain to provide care for them. As someone else said, there's no more intensive care. There's nothing else, but it's still a vital lifeline that we need to stand up and defend. Thank you so much.
Thank you so much, Dr. Al-Quds. We appreciate your powerful words. Next, I'm going to ask Dr. Mariam Komarami to share her words with us. She has just come out of a hunger strike that she organized in solidarity with our people in Gaza. Dr. Mariam, please go ahead.
Thank you so much. I'm so glad to be with you all today. I'm a physician in Boston, and reading online and hearing the testimony of our colleagues in Gaza is almost unbearable. To just think of the desperate plight of people who have been risking their lives to provide healthcare and now are faced with needing to flee themselves and abandoning their patients or trying to take patients with them. There are no good answers. It's a horrific situation. I have been I've organized a group of healthcare professionals and community members in the Boston area to do rotations of 7 days of hunger strikes, where we're taking in only water and electrolytes. 35 of us will finish such strikes during this month in an effort to draw attention to the genocidal policies of the United States government and the lack of action in protecting the people of Gaza. As desperate as the situation is, it's clear that we can't take the path of despair, that we have to continue to fight to demand accountability from our elected representatives. And we're particularly calling on our Massachusetts state senators to introduce the Block the Bombs bill in the Senate and to show leadership in fighting back against the genocide. Thank you.
Thank you so much, Dr. Mariam. The acts of solidarity all count, they all matter. I understand that we have several media contacts here joining us today, and I think the ask from our media is that they join this fight against genocide. We've seen over the months, the past 20 months, 24 months almost now of this genocide, complicity across our government officials, but also our media that has been silent. So we want to invite our media representatives, anybody in media, to share and amplify these messages. We may not have a lot of time for the north of Gaza. We may actually be dealing with 48 hours or less until the total collapse of the healthcare system, and we all know what that means for our people in Gaza. So if we all come together in this fight, media, doctors, healthcare workers, and all of us demanding accountability, demanding justice from our governments, I think we can make a difference. I will now also invite any of the media contacts, if they have any questions, to raise their hands, and maybe we can bring them up to share their questions so that we can continue with this press briefing.
I just possibly add just something else, just to another comment to what you were just saying in terms of time. I think some in the media will also know from what they've seen. We do have a constant WhatsApp group where we talk about live events happening on the ground in Gaza. In terms of speed of how we sort of envision forced mass displacement of the population. When we talked about Kamal Adwan, we witnessed this over a period of months where the last hospitals were under siege. And because it was documented, I do feel that has slowed some of the process down because the attacks on the hospital were very visible and very prominent within the mainstream media, in the same way that Nasser Hospital was very well documented, and therefore it took several days, if not a week, in terms of the media cycle. With regards to what's happening in Gaza, because the internet is out, because these things are not visible, because they are not being talked about, I feel that's quite accelerated. And we saw this in effectively the mass forced displacement of the Jabalia North, which is the northern governorate. So we're now down to the Gaza City governorate. And all three hospitals, so the Indonesian Kamal Adwan and Al hospitals, within probably less than a fortnight of each other, there was no internet. All three of them were attacked and decommissioned, and therefore the rest of the population followed straight to Gaza City. So I do think we do have precedent of what forced mass displacement following the collapse of healthcare looks like. And I feel right now, I think this is a much more accelerated picture than we've ever seen before. So I don't really know what this means for the population of Gaza.
Yeah, also combined with the direct targeting of journalists in Gaza. We've seen in the last, few weeks how many Palestinian journalists have been attacked and targeted and killed. There's one question from an attendee on the supply of food, water, and medicine to the besieged hospitals that have military operating in their vicinity, such as Al-Shifa. Maybe Dr. Chang, you can share some information about that.
So there's no evidence to suggest there's any sort of military operations or activity near any of the hospitals within their premises or near them. But with regards to food, medicine, supplies, this is often in the situation where a hospital is in a red zone. OCHA and the WHO often have to coordinate with the Israeli military to ensure that supplies are safely sent to the hospitals. And at the moment, from what we know, the supplies are being blocked, and the Israeli military is rejecting any resupply of certainly fuel to the hospitals. So right now, I think there's probably about less than 72 hours worth of fuel supplying these hospitals. And again, it's being rejected. Just on a point of the border crossings, one aspect, particularly with the north, the Jordanian Field Hospital, which is a military hospital, a very significant event is that the hospital has been given evacuation orders a few days ago, and they are leaving. This hospital is effectively Jordanian government presence. They provided some sort of diplomatic and political presence in the area. The fact that they are leaving does suggest quite heavily to the locals that there is annexation about to be happening in that particular area, which is Tell el-Hawa. And it's also setting a precedent for the rest of the hospitals. So it's really a psychological element to suggest that actually, if the Jordanian Field Hospital is leaving, then the rest of the hospitals really have no protection.
Yeah, thank you. Any other questions from the audience? Okay. If there's no other questions, I think we can conclude this press briefing. Oh, somebody raised their hand. Okay, I'm gonna allow John to speak. Please go ahead, John.
Yes, hi. Have there been no questions from the media who are present or comments even from the media that are present. I'd be very surprised if they didn't have any about what we've all just heard.
We haven't received any questions as of yet. Thank you, John.
John, I have had some personal text messages, so I know we have quite a lot of media who are very interested in this and very interested in reporting it. So I've personally had some direct text messages.
There are a few questions that are coming actually in the Q&A. One question is, as civil society, what message can we share across our community and networks? Maybe I'll ask Dr. G to start answering this question.
I mean, we've coalesced as a coalition in Canada, healthcare workers who stand against genocide, and we're trying to build the people power necessary to push our federal government to do what is necessary in this moment. And I think the more that we amplify voices from the ground in Gaza, the more that we try to do this work of what, like, Anas al-Sharif was doing and so many other Palestinian journalists were doing, we need to take up that role. We need to take up that role of amplifying what is happening so that there is additional protection. Because when the world, and especially when the Western world, is watching what is happening in Gaza, there are layers of protection. Israel slows down. They do, they're still going to do what they're going to do, but they do it slower, as was already mentioned. And if we can slow that down, then we can save lives. And that's within our power. And when we're able to do that, we are also trying to end the forms of complicity in the West, right? And this is within our power to do. It's our responsibility to do, for us to hold our governments accountable and say, not in our name, with our taxpayer dollars, are you going to subsidize and fund this genocide being committed by Israel? And that's our responsibility to do, to hold our governments and companies and institutions accountable. And so in this moment, it means doing everything that we can to pressure our governments, and particularly our federal government, whether it be in Canada or in the United States or in the UK or in Australia or France, wherever you are tuning in from, that there are things that they can do to put diplomatic and political pressure and economic pressure on Israel to slow this down and to put it to an end.
Thank you very much. I think this concludes the question, and I think we've shared the media contacts. Azra is our contact in the UK. I'll be taking any media requests from Canada, and Dr. Nidal Shpour will be taking any media requests in the US. Thank you all for joining us. I hope we can all take this information towards taking action, building momentum, and working together to end genocide.